If you're a man over 50 and find yourself waking up 3 or 4 times a night just to urinate, let me assure you, you're not alone. And despite what you might think or what you've been told, it's probably not because you drink too much water before bed. The actual culprit may be something far more silent, far more common, and thankfully, something we can address: your prostate. I'm a board-certified urologist based in the United States, and for the past 20 years, I've dedicated my career to understanding men's urinary health. I've worked alongside renowned researchers, delved into the latest studies, and treated thousands of men whose lives have been upended by night after night of restless sleep, all because of the urge to urinate. What I've learned, and what I want to share with you, could change how you think about your nightly routine and, more importantly, your health. Let's begin by understanding why this happens. First, let's talk about the prostate, a small gland about the size of a walnut that sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. As men age, it's common for the prostate to enlarge, a condition we call benign prostatic hyperplasia, or BPH. While benign means it's not cancerous, it doesn't mean it's harmless. When the prostate grows, it starts to press on the urethra. Imagine squeezing a garden hose while the water is running. The flow slows down, and pressure builds up behind the squeeze. The same thing happens in your urinary system. The bladder, which would normally empty itself completely, starts struggling. It can't push all the urine out in one go, so even after you've gone to the bathroom, a little bit of urine stays behind. Now, you might think, well, I'll just avoid drinking water in the evening. But here's where it gets interesting, and why reducing your water intake rarely solves the problem. As men age, the body's production of a crucial hormone called antidiuretic hormone, or ADH, decreases. ADH's job is to tell your kidneys to make less urine at night, allowing you to sleep through the night without interruption. But as ADH levels drop, your kidneys don't get the memo. They keep making urine at the same rate as they do during the day, or sometimes even more. The result? Your bladder fills faster, and because it's not emptying completely due to the enlarged prostate, you feel the urge to urinate more often. These two factors, an enlarged prostate compressing the urethra and a natural drop in ADH, combine to create the perfect storm for nocturia, or waking during the night to urinate. It's not about how much you drink, it's about what's happening inside your body. So, what happens if you ignore these nightly disruptions? While it might seem like a minor inconvenience, the consequences can be significant. First, let's talk about sleep. Chronic insomnia caused by frequent awakenings isn't just annoying, it erodes the foundation of your health. Night after night of broken sleep leads to daytime fatigue, makes it harder to concentrate, and can even impair your memory. Over time, poor sleep increases your risk of developing depression and can worsen existing mood disorders. But that's not the only risk. For older adults, getting up multiple times a night increases the risk of falls. Picture yourself, groggy and half awake, shuffling to the bathroom in the dark. Each trip is a new opportunity for a misstep. Falls in the elderly can lead to broken bones, head injuries, and a loss of independence, outcomes that can be devastating, both physically and emotionally. Ignoring the underlying cause, an enlarging prostate, can lead to more severe medical problems as well. If the bladder can't empty properly, urine can back up, increasing the risk of urinary tract infections. In some cases, the blockage becomes so severe that urine can't pass at all, a painful and potentially dangerous situation called acute urinary retention. Over time, the constant pressure can even start to damage your kidneys, leading to chronic kidney disease. The good news is, you don't have to simply accept this as an inevitable part of aging. There are practical steps you can take, starting today, to address the problem and reclaim your nights. First, make regular appointments with your urologist. Early detection and monitoring are key. Your doctor will likely recommend a PSA test, which measures prostate-specific antigen, a protein produced by the prostate, in your blood. Elevated levels can indicate a problem with the prostate, though not necessarily cancer. A prostate ultrasound may also be performed, giving a clear picture of the gland's size and any changes over time. Lifestyle modifications can make a real difference. Start by limiting your intake of caffeine and alcohol, especially after the afternoon. Caffeine is a diuretic. It makes your body produce more urine, and both caffeine and alcohol can irritate the bladder, making symptoms worse. Try to shift your coffee or tea consumption to the morning hours and enjoy alcoholic beverages earlier in the day, if at all. Medications are another important tool. Two main types of prescription drugs are commonly used to treat BPH. The first are alpha blockers, which relax the muscles of the prostate and bladder neck, making it easier to urinate. You may notice improvement within days. The second are 5-alpha reductase inhibitors, which actually shrink the prostate over time by blocking the hormone responsible for its growth. These take longer to work, but can be very effective in the long run. For some men, medications aren't enough or they cause side effects. In these cases, minimally invasive procedures can offer relief. Techniques such as transurethral resection of the prostate, TURP, laser therapy, or prostatic urethral lift can remove or shrink excess tissue, restoring normal urine flow. These procedures have become safer and less invasive with advances in medical technology. But treatment isn't just about what happens in the doctor's office. There are steps you can take at home to support your urinary health. Kegel exercises, often associated with women, are just as beneficial for men. By strengthening the pelvic floor muscles, you can improve bladder control and reduce urinary urgency. Maintaining a healthy weight is also crucial. Obesity is linked with a higher risk of BPH and more severe symptoms. Aim for a balanced diet, rich in fruits, vegetables, whole grains, and healthy fats. An anti-inflammatory diet, one that limits processed foods, added sugars, and red meat, may support prostate health and overall well-being. Hydration is important, but timing matters. Don't restrict your fluid intake to the point of dehydration. Instead, try to consume most of your fluids earlier in the day. In the evening, sip water slowly and avoid large drinks within 2 hours of bedtime. If you smoke, now is the time to quit. Smoking is linked to bladder irritation and increases the risk of bladder cancer. And while it might seem unrelated, regular physical activity is a powerful tool. Exercise improves circulation, helps manage weight, and may lower inflammation throughout the body, including in the prostate. Perhaps most importantly, don't ignore your symptoms. Many men feel embarrassed to talk about urinary problems, or they assume it's just part of getting older. But these symptoms are your body's way of telling you something needs attention. The earlier you address them, the better your chances of preserving both your sleep and your long-term health. Let's recap. If you're waking up multiple times a night to urinate, it's rarely just about how much you drink. It's a combination of natural aging processes, like the enlargement of the prostate and the decline in ADH production, that disrupt your bladder's ability to store and empty urine efficiently. Left unchecked, these changes can chip away at your quality of life, increase your risk of falls and infections, and even harm your kidneys. But you're not powerless. Through regular medical checkups, smart lifestyle choices, and, when necessary, medications or minimally invasive treatments, you can manage these symptoms and take back your nights. So, if you or someone you care about is experiencing these symptoms, don't wait. Talk to your doctor. Share this information with friends and loved ones who might be suffering in silence. Many men live with these issues for years, thinking it's just another sign of aging, without realizing there are effective solutions available. Your sleep is precious. Your health is worth protecting. You deserve to wake up refreshed, not exhausted by repeated trips to the bathroom. If you've learned something valuable today, I encourage you to leave a comment below. Let's start a conversation. Follow this channel for more expert insights on men's health and share this information with friends and family over 50. Together, we can raise awareness and help more men live healthier, more restful lives. Remember, you don't have to accept poor sleep as your new normal. With the right knowledge and support, you can take control of your health, one night at a time.